Hi, welcome to online review demo number 1, brought to you by Grant ENC Services. And we will be talking about your increased intracranial pressure and the decompensatory mechanism that occurs in this disorder. Let's start. First, let's talk about the increased intracranial pressure. Now, when you say increased intracranial pressure, this is a condition wherein the ICP or intracranial pressure exceeds the normal pressure, which is the 15 millimeter mercury. Now, this 15 millimeter mercury ICP has components, or these are the factor na bumubuo sa inyong 15 millimeter mercury. Namely, the blood in your brain, and the CSF. So, these are the three factors na bumubuo ng ICP nyo na 15 millimeters mercury. However, minsan, isa sa mga factors na ito ay tumataas ang amount kaya nagkakaroon ng increased intracranial pressure. For example, the blood component increases with aneurysm, head injury, and hemorrhage. So if you have vehicular accident, na-bump yung ulo, tumataas yung blood sa ulo, tumataas yung ICP nyo. Sometimes, the brain factor increases, and this condition is usually caused by your tumor. So if there's increased number of brain cells, remember that your brain is encased in your skull, therefore, your skull does not expand, therefore, tumataas yung ICP. And there are times where the CSF increases, a condition that we call your hydrocephalus. So these are the three components that form your 15 millimeter mercury ICP. Next, let's proceed to your decompensatory mechanism. Now, in decompensatory mechanism is a condition wherein instead of adapting to the condition, what actually happens in the body is it worsens the condition. To better explain it, let's start. Now, let's begin with the increased ICP. Now, remember, if there's an increased intracranial pressure in the brain, there will be a decreased cerebral perfusion, which means hirap nang magpadala ng dugo sa ulo kasi nga mataas yung pressure. Now, if there's a decreased blood flow to the brain, yung carbon dioxide sa brain, hindi yan natatanggal. Diba? Remember, ang blood pupunta sa isang lugar, sa isang organ mo, dadalhin niya yung oxygen dun sa organ, kukunin niya yung carbon dioxide, pabalik sa lungs para ma-excrete. Tama? But here in this condition, since hindi nadadaluyan ng dugo o sapat na dugo ang ulo, hindi nakukuha yung carbon dioxide sa ulo. Therefore, nagkakaroon ng build-up ng CO2. Nagkakaroon ng increased carbon dioxide. Now, take note of this. In increased intracranial pressure, there is a build-up of CO2 in the brain. And because of this increased CO2, the reaction will be vasodilation. Ang blood vessels ay nagdadilate in the presence of increased carbon dioxide. Now, if there's a vasodilation, automatically there will be increased edema formation. Kasi may vasodilation eh. And this edema formation further increases your ICP. That is why it's called your decompensatory mechanism. Okay? Now, take note that a client who has increased ICP has edema. That is the reason why the doctor will order mannitol. Next, take note that the client with increased ICP has a buildup of carbon dioxide in the brain. Therefore, we instruct the patient to hyperventilate. And last but not the least, a client who has increased ICP has a vasodilation. Therefore, you make sure that you elevate the head of the bed to drain the blood towards the heart so that it will result to the decrease in the ICP. So this is the decompensatory mechanism that occurs with increased ICP. I hope you learned something. Thank you.